Today, I am joined by Dr. VAHID Tavakoli from Lima Memorial Hospital and their Heart Institute. And first of all, doctor, thanks for joining us today. And we're going to be talking a little bit about cardiac MRIs. And I understand Lima Memorial is the only cardiac MRI with capabilities in our region. So can you tell us a little bit more about what a cardiac MRI involves?
Good morning, Glenn, and thanks for having me. So MRI is taking pictures of the body with the magnetic features. It gives us very high quality pictures. We have several ways of taking pictures of the heart. We have ultrasound or echocardiography, but the point is it doesn't see the whole heart. If you don't see the whole heart, you'll miss the stuff. MRI on the other side can see the whole heart, and it gives us detailed pictures with the magnetic features. That's the good thing about this, and that's the way it can be useful to the patients.
Okay, so if someone is concerned that they might have a heart condition of some type that needs to be looked at a little bit further and deeper, how can they receive a cardiac MRI?
So the first step is to talk to your heart doctor or to your family practice. Most cases, they do not need heart MRI, but in some cases, we need the detailed pictures of the heart, and that's where heart MRI enters.
So a heart MRI, how long does this process take under most conditions?
So before doing heart MRI, you have to lay on a bed and you'll go through a donut. This donut takes pictures of the heart. We will ask you to breathe in and hold your breath, and then we'll take pictures of the body of the heart. It takes about half an hour to 1 hour. Before doing this procedure, we will ask you if you have the fear of closed spaces or claustrophobia, because that can be a barrier to the procedure. We will ask you about the implants in the body. We will make sure that the implants are compatible with MRI.
So you are the only facility in this region that is able to do this. So what makes this so much, I know you told us it's a lot better than looking at other images, but what makes this really so special that you're able to use this to your advantage?
So MRI can diagnose wide problems. I start with one popular and well-known problem. It's coronavirus, COVID-19. COVID virus, it attacks the heart muscle, just the same as it attacks the lungs. Many cases these days we see they come to us with shortness of breath, with chest pain, with palpitation, and they have done lots of tests and they're all normal. Their echocardiography, stress test, chest CAT scan, they're all normal. And in some cases we do a heart MRI and we get those high quality detailed pictures and we see inflammation in the heart. Inflammation is one case that only MRI can show. And that way we can treat it better in those cases where every other way of testing and heart tests, they have already failed. Heart MRI can also diagnose tumors without even opening the chest. So you don't have to do surgeries if it's unnecessary. In heart MRIs, you can do stress tests, you can take information that you can get from just echocardiography. You can combine different tests. Like instead of doing an echo and a stress test, you can just combine it and do a stress MRI. You have done a stress test and you've got the information that you get from echocardiography. Less time, less cost to the patients.
Dr. Tavakoli, thank you so much for this wonderful and great information, and hopefully we can put it to very good use in the very near future. And if people want more information, they can certainly use the information at the bottom of their screen. And we'll be back with more right after this.